Hi, everyone, and welcome to The Doctor is In. I'm Dr. Freddie Gomez, and just to make everyone aware, we make this program for you because we hope that we can provide you with the virtual care that you need in this time of COVID 19. So, for this episode, we all know that the rainy season has officially started, and there are illnesses or diseases that are common during this time of year. And one of those is dengue. So alam natin, very familiar po tayo sa dengue at ngayon, yung panahon, common na ulit ito. And that's what we're going to talk about today with our guest. So our guest for today is Dr. Karl Evans Henson. He's an infectious disease specialist at isang consultant sa The Medical City. Welcome to the show, Dr. Henson.
Hi, thanks for having me, Freddie.
Yes, Carl, we all know that dengue is a serious problem, especially this time of year. Ngayon, it's a disease which is transmitted through the bite of an infected Aedes mosquito. But bakit ba napaka-uso ang dengue ngayon na tag-ulan?
All right, so like you already mentioned the name of the mosquito. So dengue is transmitted by a mosquito called Aedes aegypti. No, but you know from the naked eye you can't really distinguish what's Aedes aegypti from the other mosquitoes. No, the mosquitoes they lay their eggs on stagnant water. No? So during rainy season, mas maraming areas na may stagnant water. So mas dumadami yung breeding sites for these mosquitoes, increasing the likelihood that they multiply and then some infected mosquito will bite you.
Okay, so napaka-importante talaga to maintain cleanliness inside and outside our homes to get rid of itong mga breeding sites ng mga mosquitoes, ano? So one of those is
Yeah.
standing water. So yan ang malaking problema at kalaban sa dengue. So we need to observe good personal hygiene, and we also want to aside from how dengue is very common now, we also want to talk about studies that say dengue and COVID-19 share similar features. So there was one study in Singapore, another one in Brazil, that showed how dengue and COVID-19 had comparable symptoms and laboratory results. Dr. Carl,
Mhm.
ano kayang ibig sabihin nito? How is this important for us Filipinos where dengue is really common as well?
Okay, so the key similarity between dengue and COVID is that they are both caused by viruses. Completely different viruses, pero viruses kasi in general, especially those yung nagko-cause ng lagnat and yung usual na fever syndrome, no? They present similarly in terms of laboratory tests, etc. So I think now it's flashed on your screen the symptoms of dengue: headache, rash, eye pain, nausea, vomiting, sometimes bleedings, muscle aches. But fever is also a cardinal or a very important symptom of dengue. And then when we look at COVID naman, fever then is a very important manifestation of COVID. Ang predominant na symptom na isa pa is cough as well. But sometimes COVID will be asymptomatic. No? So because of the similarities, no, when a patient gets fever kasi may kasamang headache yan, may kasamang muscle aches and pains, yung feeling na parang may trangkaso, that's very prominent in dengue, and you can also feel the same symptoms with COVID-19. So it's pretty difficult to differentiate the two. When you see a patient come into the emergency room, for example, or in a clinic, no, because of the similarities in symptoms, mahirap silang set apart.
That's right. And also, now is the time that we read our questions from our viewers. But before we do that, before we read some of those questions, let's revisit some of the symptoms of dengue. Some of them that you mentioned also, Dr. Carl. So could you tell us what typically would a patient experience? Someone with dengue, anong mararamdaman nila?
Okay. So, ang classic na manifestation ng dengue is usually yan 3 to 4 to as much as 7 days of fever, And then yung fever, may kasama yan na headache. And then a classic also that they will complain about is retroorbital or yung pain behind the eyes. No? And very significant or very prominent yung muscle aches or yung bone pains. No? Um, another word or another name for dengue is breakbone fever because of the prominent muscle aches and pains. Sometimes you can get joint pains. You can also sometimes get a rash. No, there are two kinds of rash, but the rash usually comes in the later part of dengue fever. And then there's sometimes, especially later in the course, you can get bleeding manifestations, especially kapag mababa na yung platelet count. And then when we look at the laboratory tests, magkapareho din sila ng nangyayari with COVID. The the white blood cell count in your CBC, bumababa rin siya. And then in dengue, mas prominent yung pagbagsak ng platelet counts. But that can also happen with COVID.
Okay,
Yeah, I mean,
I like how you mentioned another term for the fever of dengue is breakbone fever. So uh, I've been fortunate enough not to have had dengue yet in my lifetime, but I've had friends who really describe the pain as something talaga hindi siya pangkaraniwan na joint pain. Napakasakit
yeah.
talaga nun ng joint pain when it comes to dengue fever. So again, we want to emphasize the importance of good personal hygiene and cleanliness of our surroundings to prevent dengue, as well as COVID 19. Now it's time to answer some of the questions from our viewers on Facebook. So here's a question: can a person have COVID 19 and dengue at the same time? How can you tell if it's COVID 19 or dengue fever? What do you think, Dr. Carl?
All right. So yes, a person can have as many infections as she or he likes. So certainly dengue and COVID can coexist in the same person. Malas na malas yung tao na yon, but that can happen. No. Like we already said, the symptoms are very similar. So sometimes you will not be able to tell them apart. There's a study out of Singapore, I think, where they misdiagnosed dengue because they did the dengue test na nag-positive tapos COVID pala. So there's a test ng dengue that can cross-react with COVID. It's I think later on we will talk about it. No, so but when just looking at symptoms, we can't really tell them apart. I guess the most useful na lang that I can say now is cough and respiratory symptoms are not as prominent with dengue, but they're very very prominent with COVID-19.
That's right. So just to emphasize, so it is very difficult to second guess or even guess for that matter when it comes to these situations. Kaya napaka-importante for our viewers pag meron kayong nararamdaman at, at kahit na may bahid ng hindi kayo sigurado, magpatingin na po sa doktor. So we have another question from our viewer. What are the chances that a COVID-19 patient is misdiagnosed for dengue? Could that actually happen? You mentioned something like this also, wasn't it, Dr. Carl?
Right. So there was a case report. I believe it was Singapore. No, the patient presented with fever. They tested him for dengue, what's called dengue IgM. So this is a dengue antibody test. Initially, nag-positive. So they believed the patient to have dengue. Treated the patient for dengue, and then the patient developed severe respiratory distress, tested him for COVID, tapos COVID pala. When they retested the antibodies for dengue, negative na. So the suggestion of that paper is there may be some cross reactivity between the at least the testing kits for the antibodies of dengue with that of COVID-19. Fortunately, the other test that we use for dengue, yung tinatawag na dengue NS1, which is what we use in the first 3 days of fever, that's a pretty specific test. So wala naman pong report na there's a confusion with that test with COVID-19.
Okay. And we will continue this conversation with Dr. Karl Henson in just a moment. But I'd like everyone to remember that these Aedes mosquitoes that can cause dengue are day-biting mosquitoes. Ibig sabihin, they're most active during daylight hours until a few hours before sunset. So if you're out and about, it's also good to use insect repellent to keep those mosquitoes away. So we're going to take a quick break. When we return, prevention of dengue, care, and treatment. Stay tuned to The Doctor Is In right here on CNN Philippines. Welcome back to The Doctor Is In. I'm Dr. Freddie Gomez, and we want to make the most out of your telemedicine appointment today. And we definitely want to hear from you. So please do send in your questions via the CNN Philippines Facebook page para naman makasama kayo sa ating discussion today. So earlier, we were talking about dengue and some similar features of this disease with COVID-19. Kailangan talaga mag-ingat tayo, lalo na sa mga panahon na ito. So let's welcome back our guest, Dr. Karl Evans Henson, who is an infectious disease specialist from the Medical City. Now, prevention is key, especially with dengue. And with the pandemic, our healthcare system is definitely overwhelmed with COVID-19 patients. Our next question to you, Dr. Karl, what are the treatment options available for someone with dengue?
All right. So dengue fever is basically treated what's called supportive management. No, for the mild cases, usually just paracetamol and maybe something for the muscle aches if hindi kaya ni paracetamol. Increased oral fluid intake, and then they can stay at home. But for the sicker patients who need to be admitted, they are given IV fluids, and then of course there's still the paracetamol or antipyretic, and basically just addressing the symptoms that they feel, and then monitoring the blood counts, no? Waiting for the white count to drop, and then not the white count, the platelet count to drop, and then it'll go back up, and then they go home after the platelets go back up. So it's basically supportive management. There's really no definitive medicine against dengue.
Okay, so for the benefit of our viewers, ang sinasabi po ni Doc, dahil po ang dengue ay isang virus, ang tinitreat po natin doon ang inyong simptomas. So if people would expect kung meron bang antibiotic ba dito, meron bang gamot para mawala yung dengue sa katawan ko, wala po yon. So what Dr. Karl is saying with supportive treatment is inaalalayan yung sariling katawan para
Yeah.
lumakas yung resistensya at yung sariling katawan ninyo o yung may dengue ang magpapalunas po dito. Okay, so Dr. Carl, we have a lot of questions from our social media audience. Let's take a look and answer some of them, shall we? So we have a question from Aaron, and he's asking, "What should I do if I have symptoms of dengue? Do I go to the hospital immediately, given the threat of COVID-19?" What do you think, Dr. Carl? Anong dapat gawin?
Okay, so what should I do if I have these symptoms? So I guess it really depends on how severe the symptoms are. Remember, dengue, pwede yan mild symptoms lang, a little bit of fever, walang ubo. If kaya magpunta sa isang clinic to see a doctor, then why not, diba? Pero if there's no doctor available, or you feel that your symptoms are severe enough that you need to be urgently seen in an emergency room, then go ahead and see a doctor in the emergency room. the threat of COVID-19 should not stop anyone from going to see the doctor. In fact, hospitals these days have been preparing for COVID, and most of the hospitals have preparations for yung mga non-COVID patients. Tapos there's a separate area to take care of the COVID suspects and the COVID confirmed cases. So you shouldn't delay getting medical care just because you're so scared of COVID. Kasi you might end up na we're going to diagnose the disease so late now we can't do much about it anymore.
Okay, that's a good thing that you mentioned that. So, just to remind our viewers, alam ko marami po ang takot dyan na pumunta sa ospital kasi akala nila makukuha nila yung COVID kapag pumunta na sa ospital. So, hospitals, especially the ones like Medical City, they are prepared para doon po. So, just like the hospital where Dr. Karl Henson is working at, meron po silang, like what he said, merong hiwalay na area para sa mga COVID-19 and para doon sa mga uh, wala. So it is still, so those not just with those who are thinking na kung may dengue sila, any other ailments na kailangan matignan ng doktor, pumunta na po tayo sa hospital at magpatingin. Huwag na po tayong baka sakali, kumbaga. Okay? Okay, so moving on, we have another question here from Marga. Marga is asking, how efficient are dengue testing kits?
Okay. All right. So there are two different kinds of tests for dengue. There's called the NS1 kit. No, it's a protein na siya na part ng virus, and that's used in the first 3 days of symptoms of fever. No, it has a pretty good. It's a pretty reliable test. No, we use terms called sensitivity and specificity to determine the how good the test is. No, so for NS1, the specificity is about 89 to 92%. So pag nag-positive yung test, you pretty much know na talagang positive siya. The problem with NS1 is if it's negative, sometimes medyo may problem. You can't always believe it, especially if clinically mukhang talagang dengue yung patient. No? The sensitivity for those who know about is about 55 to 66%. Now, the other test is the antibody test. It's a combination IgM and IgG antibody, and it's taken or done on the patient around from day 4, day 5 until however kung it's day 7, day 10 nag-iisip ka pa ng dengue, you can repeat it. Now, the sensitivity of the antibody test is about 70%, meaning if it's negative, mas believable siya. If the specificity is about 96%, so if it's positive, then you're really sure na dengue siya, no? It performs slightly better than the COVID tests in terms of numbers, no? And then again, let me emphasize, there is some data that pwedeng mag-cross-react yung IgM test with COVID. So your doctor really needs to make a judgment call kung mukha bang may COVID, kung may respiratory symptoms, kailangan matest rin for COVID. Kung mataas yung suspicion for COVID, then go ahead and get swab. Get swab, RT-PCR, not the antibody test for COVID.
Okay, I think that's clear, very clear in itself. Thank you very much, Dr. Karl Henson, for joining us on the show. I'm sure our viewers learned a lot from you. Maraming salamat.
Thank you for having me, Freddie.
After the break, we'll provide you with practical and helpful tips on how to prevent dengue. We'll be right back.
As we move to the next stage of easing restrictions, the reality is the COVID-19 pandemic is far from over. The coronavirus remains a serious public health risk. Good personal hygiene is our first line of defense. Wash your hands often with soap and water and for at least 20 seconds. Scrub all surfaces of the hands. If hand washing is not immediately available, use alcohol-based hand sanitizers. Wear a mask. The coronavirus is transmitted through direct contact with respiratory droplets of an infected person generated through sneezing or coughing. Cover your mouth and nose with a tissue or handkerchief when sneezing or coughing. Avoid touching your face. Maintain social distancing. Keep a safe distance of at least a meter from others whenever possible. Avoid crowds. Stay at home if you have any cold or flu-like symptoms and seek medical advice. We're in this together.
Hello, everyone. We're glad you could join us today. You're watching The Doctor is In. Now, the rainy season is definitely upon us, and dengue cases and other mosquito borne diseases are expected to rise. Given that there's already immense pressure on the healthcare system with COVID 19, what can we do to protect ourselves from dengue? So, to help us answer this question, we have family medicine specialist Dr. Vivien Fe Fadrilan-Camacho. It's good to have you, doctor, and we want our viewers to be even more careful these days. So, my first question to you, doctor, is how can we protect ourselves from dengue?
Ayan. So, good afternoon, everyone. So, thank you for having me in your show. So, Dr. Gomez, so sa question mo, no, uh, alam ko nga, as you mentioned, we are still, stressed because of the COVID-19. But, syempre, dapat wag natin kalimutan yung ibang mga sakit, no? Especially that the rainy season is now upon us. So, ano bang pwede natin gawin sa ngayon? Syempre, prevention is always the key, no? Ito yung importante sa lahat. Ayaw nating magkasakit sa panahon ngayon. So in terms of dengue, the most important thing here is that knowing, no, what the disease is all about. Ang dengue ay alam naman natin na isang sakit na dulot ng isang virus, no? Pero syempre itong virus na to ay dala ng mga lamok, no? Yung tinatawag nating Aedes aegypti at syempre ang control and prevention ng mga vector-borne disease, especially ng lamok, ay paano kailangang i-control ang lamok. No? So yun yung pwede nating gawin sa ngayon. Kailangan alam natin kung ano yung sakit.
Okay, so and also is we can't emphasize enough the importance of cleanliness. So a lot of people may be asking, what can we do as individuals? Ano magagawa ko in order to help out? So, doctor, why don't we share some tips when it comes to keeping our surroundings clean, so that the viewers can realize that they can actually do something to help?
Yes. Of course, sabi nga natin, dapat kilala natin yung mosquito, no? So, ang mosquito kasi ay Aedes aegypti, they are day biters at sila ay nangingitlog sa mga plastic containers, sa mga gulong na nakakalat lang dyan. Kaya it's very important na panatilihing empty at clean ang ating mga plastic containers kasi dito sa mga may tubig na yan, dyan sila nangingitlog, no, yung mga lamok na yan. Just to share with you, also, as individuals, may pwede nating protektahan ang ating sarili mula sa dengue by just following, no, the enhanced 4S strategy of the Department of Health. So ano ba tong 4S na to? So number one, search and destroy. So search and destroy, ito nga yung mga lalagyan, containers, mga paso natin, vases, mga nakakalat lang na gulong, or anything na pwedeng kolekta, no, ng stagnant water na tinatawag na pwedeng pag-itlugan ng lamok. Kailangan linisin natin yan at tanggalin as much as possible. Yung isusunod na S ay seek early medical consultation. So lalo na nga ngayon, especially because of COVID, syempre pag may lagnat, kailangan maging alerto tayo kung ano yung possible causes of the fever. Okay? So, at syempre, para malaman din ng doktor kung ano talaga magiging cause. At dahil nga tag-ulan, hindi malala yung pwedeng dengue ang dahilan ng lagnat. At ang susunod na S ay ang self-protection measures. Ano ang mga ito? Syempre, ilayo na natin ang ating sarili na ma-expose sa lamok, no? Paano to maiwasan? Lalo na kung nasa labas tayo, if we can wear clothes na kunyari long sleeves or para maprotektahan yung skin natin para hindi makagat ng lamok. Pwede rin gumamit ng mga insect repellents, the use of mosquito nets, no? Ayun. And then pwede rin sa mga screen sa bahay, ayan, para hindi pasok ang lamok, no? Ayun. And then ang susunod na S ay syempre yung last, no, um, yung fumigation, okay? So kailangan ang iniisip kasi fumigation or fogging ay ito yung sagot, no, sa mga barangay natin, pero hindi lang siya ang sagot eh. May gamit ang fogging or fumigation at ito ay ginagamit usually sa mga adult, no, sa mga adult na mosquitoes, no. So and usually this is done during outbreaks. Yon. So those are the 4 S na strategies, no, na pwedeng makatulong sa atin para makaiwas sa dengue.
Okay, thank you very much. That was a very comprehensive explanation. And unfortunately, that's all the time we have for. Thank you very much for joining us, Dr. Camacho. I'm sure a lot of people have learned and how to protect themselves from dengue.
Thank you very much.
And as we have been saying, dengue is best prevented by avoiding mosquito bites and keeping our surroundings clean. And during this time of COVID-19, good personal hygiene is our best line of defense. I'm Dr. Freddie Gomez. See you again tomorrow at 3:30 p.m.